Hi everyone, welcome to another episode of Ask Dr. Chi. My name remains Dr. Chinoye Otuka Eze, your number one fertility doctor. In today's video, I'll be talking on fitness, one of the 6 things I spoke on previously to do to optimize your natural fertility. Now, fitness, how fit can one be in order to conceive? What weight is too much? What weight is too little? What amount of exercise is too much? What amount of exercise is too little? How long should I exercise for? And how small is an exercise not to be effective? So the first one, what weight is too much and what weight is too little? Now, research has shown that any BMI, body mass index, of greater than 35, it shows that women who have BMI of 35 and above take twice as much time to conceive and any woman whose BMI is less than 19 take 4 times as much to conceive. That shows that a BMI of 20 to 30 is okay for any woman who is trying to conceive. Now, what exercise is too much and what exercise is too little? Now, the recommendation is moderate intensity exercise. And also, one of them when they ask me, what will be moderate intensity exercise? Now, any exercise that you can be doing and have a meaningful conversation, we call it the talk test. Now, you're going to do exercise, you feel they talk to person, that is moderate intensity exercise. But any exercise where you do where you know go feel where you know feel talk with your neighbor, that is high intensity exercise. For any woman trying to conceive, whether you try to carry belly or you don't carry belly, moderate intensity exercise is recommended. How much exercise is recommended? 150 minutes weekly. That means if you can do exercise every day, you do 30 minutes every day of moderate intensity, and specify moderate intensity exercise. But if you cannot do every day, you can do it at least 3 times a week. Now, if you're not able to manage 30 minutes every day, you start with 5 minutes and progress. Each week, you add another 5 minutes until you achieve the desired amount of minutes of exercise to be able to achieve your desired goal in order to achieve pregnancy. Now, what kind of exercise can one do? I feel carry weight, I feel run, you understand? I feel do yoga. All those are recommended. It is recommended to run small, carry small weight in order to help you achieve your goal of getting pregnant. Now, it brings me to the next question. Many people will say, should they tell us, say, if you want to try to carry baby, may you not stress yourself. Now, I will say, exercise is not associated with miscarriage. Research has shown. Say you get belly, you be king commode. Exercise is not associated with it. 2, exercise is not associated, say you carry belly because you do exercise, something happened to your pikin. We call it birth defect. The pikin look abnormal. Now, lie, no be exercise. Say my pikin too small, it has nothing to do with exercise. Say I will get labor early, it has nothing to do with exercise. Say my pikin, we call it neonatal hypoglycemia. Say my pikin, the sugar when they in blood, they too small. It's not associated with exercise. Say if I do exercise, now only through CS I feel born. Now lie, there's no birth complication associated with exercise. Instead, there are benefits to doing exercise before and even during pregnancy. One of the benefits, it helps you control your weight. Moderate, as I said, moderate intensity exercise. That means you can be doing it and be talking. That's how they do, they talk. Now, like joke, you feel they dance. Some people that love to dance can dance. It's called aerobics. You know, people who feel they like to run, feel run. People who like to carry weight, feel carry weight. People like to do yoga, but let it be moderate intensity. That means if they talk, they do the exercise they do. Now, what are the benefits of exercise? It helps you control your weight. It reduces what they call gestational diabetes. Women where they seek sugar when they get belly. Naturally, they don't get diabetes, but when they carry belly, their sugar increase. We call it gestational diabetes. It helps reduces the risk of gestational diabetes. It helps reduces the risk of hypertension. It helps reduces the risk of excessive weight gain. It benefits a woman that after pregnancy, when a woman when they do exercise before they get belly, even during belly, when he born, if he help her reduce the weight drastically, she not go fat too much. It decreases your risk of pre-eclampsia. Now, Pre-eclampsia is when a woman gets pregnant and towards the end of her pregnancy, her blood pressure is high, her protein is high. It decreases your risk of having, it decreases your need, watch it, of needing to use an operative method of delivery, that's CS. So woman, when they do exercise, you have a less chance to use CS. It helps you control your weight. It helps you control your weight during the pregnancy and after the pregnancy. Women, when they get belly, they like to urinate a lot. So that urinary incontinence, it decreases it. You understand? So exercise is very beneficial. Now, let me give a disclaimer. Anybody, any woman who has certain contraindication, that certain things, certain sickness, when no go allow them exercise, may you discuss with a doctor or gynecologist. May not tell her, may do exercise. So discuss with your OBGYN to know the best exercise method that will benefit you in your journey to conceive. I know that exercise is not easy because of our contemporary, the world we find ourselves. Every woman is busy, but try as much as you can to be physically active. Whether you dey waka for your office, instead of you to sit down throughout, you stand up sometimes, walk out for 10 minutes, walk out for 20 minutes. Now also part of exercise. I hope this video has been helpful to you. If you have any questions or any clarification, you can send me an email at askdrchi@gmail.com. If you have any topic you want me to talk on, to expand on, or you have any particular topic you want me to talk on relating to exercise, you can also send me an email at drchi@gmail.com. Follow me on Facebook, Instagram, and YouTube at askdrchi. Thank you and God bless you.